Hey guys, what's going on? This is Bobby G. I'm a neurosomatic practitioner and a corrective exercise specialist. Today I'm going to talk a little bit about the cranial nerve acronym that I use, and I'm going to go over a little bit in detail on the 6 muscles of the eye, especially the 2 oblique muscles, because they can be a little confusing. So without further ado, here we go. LR6SO4, that stands for lateral rectus cranial nerve number 6. SO4 stands for superior oblique cranial nerve number 4. The rest of the eye is cranial nerve number 3. So if you can remember that acronym, the other parts of the eye are very simple with the cranial nerve. All right, so the next we're going to talk about is the 4 rectus muscles, which you have superior rectus, which moves the eye up and laterally. You have lateral rectus, which moves the eye laterally. You have inferior rectus, which moves the eye inferior and lateral as well. And then you have your medial rectus, which pulls the eye to the midline of the body or medially. Now the ones really confused on back in the day, not so much now, were the superior oblique and the inferior oblique. Because what they say or in their name is not what they actually do. So we'll talk about the superior oblique first. Its job is to internally rotate, abduct, and depress the eye. But you ask yourself, how can something internally rotate and abduct? That is antagonist, which means opposite movements. But that muscle does it, depending on the placement of the eye where the pupil is looking at that time, okay? Then your inferior elevates the eye, abducts, and laterally rotates. Well, that makes sense. Elevate, okay, abduct, which away from the body, and laterally rotates away from the body, okay? So the tricky one really is that superior oblique. But again, it also, remember, the superior oblique runs through that trochlear notch, which is right here. So that has a lot to do with the tendon pull as well. So I'm not going to go too much into detail, but I want to give you a heads up on that. Hope it makes sense. Have a great day. Bye-bye.